Veteran suicide rate and benefits. Suicide among veterans is a worldwide public health issue. It is also in the top 10 causes of death in the United States. Veterans should be compensated more with better benefits when it comes to therapy or compensation. There are multiple ideas that show the different statistics on veteran suicide. From RAND.org on an article by Rajiv Ramchand, it says, "Unfortunately, for more than a decade, the suicide rate has been rising in the general U.S. population and especially among veterans, men and women who risk their lives for this country. This Veterans Issue in Focus perspective presents data on the magnitude of the problem, identifies particularly noteworthy issues and trends, highlights recent advances, and identifies gaps that deserve increased attention for both researchers and policymakers." In its 2018 to 2024 strategic plan, the U.S. Department of Veteran Affairs identified preventing veteran suicide as its highest clinical priority. And the Rand Epstein Family Veterans Policy Research Institute is committed to helping VA and the country achieve this critical goal. The magnitude of the problem is that of veterans dying from suicide. According to RAND.org, in 2018, 6,435 veterans and 40,075 non-veteran adults died by suicide. But because there are more non-veterans in the population, the rate of suicide among veterans was 32.0 per 100,000 compared with 17.2 per 100,000 for non-veterans. For the past 12 years, the suicide rates have been consistently higher among veterans than non-veterans. Furthermore, since 2005, the suicide rate has risen faster among veterans than it has for non-veteran adults. As of 2019, adjusted rates of suicide were now at 27.5 per 100,000 for veterans and 18.2 per 100,000 for non-veterans. Sometimes there are more pressing issues when it comes to veteran suicide than we think. In the same article on RAND.org, the largest number of veterans who died by suicide are between ages 55 and 74 years old. In 2018, 2,587 veterans between the ages of 55 to 74 died by suicide. This is at a rate of 30.4 per 100,000. The difference in suicide rates between veterans and non-veterans is greater among women than men, but for veterans and non-veteran, rates are higher among men. In 2018, the suicide rate for veteran women was now at 14.8 per 100,000. That's 291 deaths, almost twice the rate for non-veteran women. The difference was greatest among women ages 18 to 34 years old. That same year, the suicide rate among veteran men was 1.2 times the rate among non-veteran men. For men, the difference was also greatest among 18 to 34 years old. Veterans who die by suicide are more likely to use a firearm than civilians who die by suicide. In 2018, 68.2% of veterans who died by suicide used a firearm, compared to 48.2% of non-veterans who did not. There are certain things that make you eligible for veteran benefits. According to military.com, your eligibility for most VA benefits is based on discharge from active military service under other than dishonorable conditions. Active service means full-time service as a member of the Army, Navy, Air Force, Marine Corps, Coast Guard, Space Force, or as a commissioned officer of the Public Health Service, the Environmental Service Administration, or the National Oceanic and Atmospheric Administration. You may be eligible for certain benefits such as home loan guarantees and education if you meet the time in service and other criteria. Honorable and general discharges qualify a veteran for most VA benefits. Dishonorable and bad conduct discharges issued by General Courts-Martial may bar those VA benefits. Veterans and prison parolees may be eligible for certain VA benefits. VA regional offices can clarify the eligibility of prisoners, parolees, and individuals with multiple discharges issued under differing conditions. Suicide as a complexity is hard to explain, says mentalhealth.va.gov. Suicide has no single causative explanation or pathway. In turn, there is no likely single solution. The loss of any individual to suicide cannot typically be explained by one individual factor alone. The problem of suicide reflects a complex interaction of factors placing strain on the individuals at the international level, which could mean wars, global pandemics, national level, economic disparities, healthcare policies, community level, employment rates, access to care, familial and relational level of support, relationship issues, or the individual level, which could be health concerns. The U.S. suicide rate may have reflected over time these unique complexities of interaction, as rates vary by region and state, by demographics, by occupation, and more. Beyond the complex interaction of multiple dynamic risk factors, certain suicide risk factors have been found to meaningfully impact veterans, as well as in some cases to differentiate risks for veterans who receive VHA services versus veterans who do not receive VHA services. Specifically, suicide rates among veteran users of VHA services are higher overall from 2005 to 2018 in comparison to those non-VHA veterans. According to various studies, a multitude of societal factors may affect veteran suicide rates. Veteran Affairs denies care to many people who serve, says Washington Post. In April, John Rios stood in the Veteran Affairs Hospital in Newington, Connecticut, seeking treatment. For more than 20 years, he had struggled with the effects of post-traumatic stress disorder. For the past 8 of them, he had fought to have the Defense Department recognize his military service as honorable. Having finally prevailed, he went to VA seeking health care, with his official paperwork in hand. The hospital turned him away, refusing to recognize him as a veteran. Rios had enlisted in the Navy in 1994 when he was 18 years old. He became a seaman on an aircraft carrier and deployed to support operations in Bosnia. The weight of war took its toll on him, as it would everybody else. After witnessing injuries and death at sea, Rios developed symptoms of PTSD. When his ship returned to Virginia in 1997, the trauma of war manifested itself in misconduct. After a series of unauthorized absences by Rios, the Navy gave him an other than honorable discharge, 6 months shy of his end of active obligated service. Though he served in his combat, his trauma-related breaches left him, in the eyes of the VA, not a veteran. There should be a better policy for all veterans except those who are on a dishonorable discharge. Most veterans suffer from PTSD and need the help to cope with that, not only for them, but for their families that struggle as well. Thank you.